Hello, everyone. So, in today's episode, we're diving into a topic that might actually make you giggle, but it actually is a topic that is quite common and worthy a discussion. We're going to be talking about flatulence, which is more commonly known as passing gas, or some people might be more comfortable saying farting.
Yes.
So while it may seem like it's a taboo subject, understanding the causes, effect, and even management of flatulence is very important in maintaining not just your own, your own appearance, and what you put out there, but also just managing your digestive health and also just overall well-being. So whether you're curious about science, the science behind this, or you're just looking at ways to maybe sort this out if it's become a problem in your life, we're going to talk about it. Let's have a good laugh. You're in the you're in the right place, and join us as we explore the fascinating world of flatulence with humor and practical tips. So let's get started.
Fantastic.
Flatulence. What exactly, Steph, is flatulence? Or, as we said, some people might like to call it a fart.
Yes. So, as Trina mentioned, you may refer flatulence as either fart, or sometimes I say passing gas or wind. So this may be caused by a lot of different factors. Mostly is when basically air is trapped in you, and you just need to release that air, which comes from the anus, and sometimes may be smelly, and sometimes may not be smelly. Sometimes it may be loud or silent. We all toot here and there. It's normal, yes. So flatulence can be caused by numerous things. As I mentioned, by air. Sometimes maybe you may swallow or chew quickly and trapping a lot of air in your stomach, which can cause the flatulence. Other times it may be caused by like the food or drink that you have. So these may actually be the causative factors for your flatulence. Other times it could be an underlying disease. It could be because you have a condition, and flatulence is one of the symptoms that you're probably portraying for that disease. So flatulence can be caused by numerous things. It can even be caused by some medications, So it is a normal thing. So flatulence is a normal thing for everybody. If you say you don't fart, sorry, you're not normal.
Yeah.
Flatulence is normal. The only thing is when it becomes excessive, or maybe when the smell is a bit off than your usual, or is accompanied by other symptoms. Let's say, for instance, blood in your stool, or maybe some abdominal pain, there are other symptoms accompanying it. So that is when flatulence becomes of concern, or maybe, it's not your usual, you're farting way too much than you normally do. That's when it becomes of concern.
Problem.
Yes, that's when it is a problem. Yeah. As I mentioned, there are loads of different factors that can cause you to fart. I think one thing I've noticed is that food is a major cause of it. Sometimes the types of food we eat, or maybe we're not digesting that food properly, that can cause you to fart a lot. Let me put it out there, I toot a lot when I eat certain products, like, the dairy products. Let's put it out there. The dairy products like milk, in...
I can't relate. I cannot relate.
You know, in Africa, yeah, I don't know if you guys have it in Kenya. In Ghana, there's this milk powder. So they have different varieties. There's like
Yeah.
Nido, Peak. And truly, it's really nice. And
Okay.
sometimes I can't
I'm
help
sure it
it.
is.
It really is, yeah. And I really can't help it sometimes. I do add it to a little bit of like my cereal with like my normal milk, which I shouldn't. Or
Yeah.
maybe I'm doing like tea or something and then I add
To
it to it.
garnish the cereal a little
Honestly,
bit.
it gives it a bit of a taste, yeah. It elevates the taste so much. But then I do suffer the consequences afterwards because I
Yeah.
know my stomach does not it does not handle those sort of products well, and then I end up, suffering. And you don't want to be in the same room.
That is not good. Good thing. I don't think we have that in Kenya. I don't think I've seen that. But the thing is, see,
Yes.
my grandma has cows, so every time I've gone Kenya, the milk that I've seen is like fresh milk from the cow,
Yeah.
literally freshly milk. But I'm sure there is powder, like milk powder, in a lot of parts of the world. So if, as we have confirmed, if you're using some of that milk powder to garnish your cereal, to add some taste to your tea and coffee, that might be the reason why sometimes your farts might push your partner out the room. So clearly there is something in the dairy product.
Yeah. I mean, it's not just the milk powder. Like, I've noticed a lot of like dairy products give me that issue. So generally speaking, I do stay away from certain dairy products. But obviously there are, sometimes something is going to hurt you, but you still do it.
But it's
the milk powder is like my weakness. So that I know.
That's it. It's like people who are lactose intolerant, but they still have ice cream. That's exactly it. Like sometimes something is so bad for you, but you just want it, and you're like, you'll go through whatever comes after it. But to be honest, dairy products can actually cause a lot of things.
Yes.
You're right.
Major
farting, or flatulence is one of them. But also I think like cheeses, like some cheeses, to be fair, cheeses don't smell good, right? So do you know what? Even before I became vegan, I never used to eat cheese as such. Like I think the taste of it, because I've been lactose intolerant, so I never used to eat cheese. Just the smell of it. So I'm imagining if you're not eating that smell, it will come out smelling even.
Like you're not alone. Everybody says I'm weird. Like that I don't eat cheese. Like, why don't I like cheese? Like, these are the main things. I don't like the smell of it. Especially, I don't want to go near a cheese. So like, because of that, I don't eat a lot of like food like containing like cheese, like even pizza. Like, everybody finds it so weird. But I really don't.
Only for the best.
Don't care. Yeah, I just don't like the smell, even the taste. Sorry to say, I know there are a lot of cheese lovers out there, but I'm not one of them. And I stay away from it. Yeah.
And I think just to mention, so my nephew asked me a question one time. He asked me, Auntie Camille, why do farts smell? And I was like, I'm not too sure, but I did some research. I don't know if you know why farts smell, Steph.
No, please enlighten me.
Okay. So I did some, because I'm like, I'm sorry, like I can't be telling him, I don't know. I told him, I'll tell you when the time is right, when there's not too many people, just me and you. So I found out about this and I had to tell him, but to explain it in a way that he understands. But it's all too scientific. But I just explained it in an easy way that a child understands. Anyway, so basically, when we eat or drink, we of course swallow saliva. Now, we also swallow tiny amounts of air, right? Now, this air that we swallow accumulates in the gut, right? And that can cause farting. But sometimes, also, when we are digesting food in the gut, we know that there's bacteria, good bacteria, bad bacteria, there's that in the stomach, right, in the gut.
Yeah.
So bacteria creates gas, mainly hydrogen, methane, and carbon dioxide. So when food decomposes in the digestive tract, it can produce sulfur, which can produce an odor. So what you're farting and then is sulfur. And some people, I think, produce too much sulfur. That's why some people fart and it's just air. Maybe there's not even sulfur produced. It's just nice. And then some people will do it and there's so much sulfur produced. And that's why some people kill other people with their farts because of too much sulfur produced in the gut.
Yes.
So that is why farts smell.
Wow. Okay, that's a very fun fact to know. Like, yes. I mean, that was not something like I really wanted to find out, but it's good to know. Yeah. It's really
I mean, if because children ask all kinds of weird questions, don't they? Like, you know, Mom, why do farts smell? So you can just say it's to do with the, you know, when gases in the stomach come out, some of the gases smell, some of them don't smell. But sulfur does have a smell. If you've ever smelled sulfur, it does have a smell. So it makes sense that it would be what comes out. And of course, it's going to have an odor.
Yes.
But we've talked about, I think, what causes flatulence, and you've said dairy products. Is there any other foods that you have realized?
I was actually going to. I was actually going to mention that. Eggs. Yeah. Let's put it out there. Eggs. Too much eggs is going to cause you. My people. Oh my goodness.
People with eggs.
My people.
Oh, Lord.
Listen.
When they garnish their food with egg and then a little bit of that milk. Ooh.
Listen, we love our eggs here. We can eat it with every single meal. We'll have it for breakfast, lunch, dinner.
Simply put.
And
as a snack as well. You can still have it as a snack.
We love it so much, guys. I'm one of... Listen, you know, because I'm a pescatarian now, so I eat like fish, and the only other protein source I can have is eggs. So now it's even more. It's even more.
So when you're having egg, can you please just let me know? Because I should be looking at the strangers around me thinking, who has just done that?
No, but with me, as I said, I know what causes me to have like excessive like flatulence, and eggs are not one of them. So thank God, thank God. But obviously, eggs can make you get excessive flatulence. In some people, it does, but not for me. Thank God. Thank God.
That's good.
But
that is good, because eggs, when the way they smell coming out is bad. You can tell when someone had egg for breakfast, when they, you know, like if they just eaten egg, because their farts will smell like rotten eggs.
Rotten eggs,
smell right.
And rotten eggs don't smell good. They don't smell good at all. Yeah. No. But
is there anything else you have reacted to? You said,
that's what I was going to ask you. That's what I was going to ask you. Do you know there's certain nuts as well? There's certain nuts here. When, I don't know, I think maybe when they're coated or something, it sometimes gives me a bit of like reaction, like where you know, it's not too good. Yeah, so I've realized certain nuts, like certain like it could be like peanuts, cashew. Like I'm good with them, but I think sometimes when I eat too much of it, like I eat too much of it, I do notice that it gives me a bit of wind, you know. It's not that great. Yeah. And
probably something in the nuts, I'm sure.
Yeah.
Something that produces certain gases.
And I think there were some people, I heard this, there are some people that say like beer, like some sort of drinks, actually like cause them to have...
gas both sides as well.
Cause them to have like, you know, excessive flatulence, like beer, I think, like, you know, the fizzy drinks as well. Even some fruit juices, like, you know, do cause like excessive flatulence. But I think those are the main food for me, unless I can't think of it. Like when it does come out, like those are the main food,
Okay, please,
like food
please
for me.
let us know, because then people will be like, okay, that explains why X, Y, Z.
Yeah,
You know?
yeah. I mean, if you come to
Yeah.
our culture though, like my culture, like Ghana, there are
Yeah.
certain products out there which I know when I have it, yes, it's gonna
Oh,
it's
like
gonna go
what?
up. Yeah, I don't know if you know this. There's this baby product called Cerelac.
Oh, Cerelac, yeah.
Yes, and honestly, I still do. Like I used to have it a lot, yeah, when I was a teenager. Now,
Yeah.
not really. But that
Yeah.
also, I realized that it does make me have excessive flatulence because I think
Mm,
there's some sort of milk in there, and as I mentioned, some milk gives me, flatulence. So I
yeah.
think there's something in that Cerelac here. So now I don't really eat it
Possibly.
as much. Yeah,
No, possibly.
yeah,
There probably is. But there is Cerelac. I know I've seen Cerelac in Kenya. So
yeah. Oh,
I haven't
okay.
had it as an adult. It is
I thought
mostly
it
like
was
a
just it.
baby's food. So
Ye-
I've not had it as an adult. So I don't know how it would
Listen,
affect
there's
me.
some
And I'm
adults
sure
like me. We
li-
eat it.
I've had so many people who have Cerelac, right? And to be honest, I
Yeah.
tasted it, and I could see why people
Mm,
like it, because I've
yeah.
even like Cow and Gate. I think it's Cow and Gate. I can't
Ye-
remember if it's Cow and Gate, but they do like a something that tastes almost like Cerelac. And my nephew
Yeah.
has it, right? And I always I've tasted it before, and I've thought, do you know what?
It's quite
This does not
nice.
taste so bad. And they even have vegan one as well now. So I'm like,
Yeah.
oh, this is a little snack, you know?
Yeah.
So yeah, no, it probably affects people like that,
Yeah.
and that explains why sometimes kids have got wind, possibly
Mm.
because they eat it and they can't really release it. So you kind of have to do those exercises with the legs to get the wind out, and
Yeah.
explains that.
Yeah.
I I don't actually get affected by any of the things that you've mentioned, fortunately,
Okay.
but it doesn't mean I don't fart. Okay, I'm not saying I fart excessively, but
Yeah.
I mean, you know what? First of all, it is actually very normal to have about 8 to 14 farts a day. So if you're
Really?
releasing wind about 14 times a day, it is quite normal. Some people release wind about 20 times a day, some people 30, but 8 to 14 is an average number, so it is normal. And as we
Okay.
said, and as you said, Steph, anyone who says they don't fart is a liar, because we know that
Yes.
everyone releases wind or gas in the form of
Yes.
flatulence. That it is very normal. It's very common. It is a normal thing. It's just your body
Yeah.
doing its thing, right? Now, for me, certain foods cause me to fart.
Okay.
And I have found out that actually a lot of people get affected by the same things, right? So
Okay.
some beans, especially some beans and
Oh,
lentils. If I have some
yes.
beans,
Yes.
wow, I'd be like, wait, hold on, what
It's
is
true.
going
Yes.
on? And it
I
doesn't
forgot about
stop.
that.
Yes. So beans can actually cause farts,
Yes.
and that I know that most people actually keep
For
off
sure.
beans. Like even baked beans, are like, no, I'm not having those. They'll
No,
make me
I'm not a
fart.
fan of it.
You know.
Yeah.
So it is known to cause farts, something like baked beans or just
Yes.
beans as a whole. But what I found out
Yeah.
is actually complex carbohydrates can actually cause a lot more buildup of a lot more gas. So and
Yeah.
there is complex carbohydrates in beans, which are of course normally a little bit difficult for humans to digest. So
Mm-hmm.
these, of course, if they're a little bit difficult to digest, what's going to happen is they will reach the
Yeah.
intestine, and then the bacteria will feed on them, and then there'll be the production of gas, and in this case probably sulfur, so it'll be a smelly gas. So it
Yeah.
is normal for people to have smelly farts after eating beans or any sort of like complex carbohydrate.
Yeah.
Some lentils, not all, some lentils do make me fart. Now there is the red, I think they're called red lentils. I'm not too sure. Those ones, I don't know if they sulfur in those little babies, and they're so delicious. But I just need a little bowl, and so some
Yeah.
lentils can cause that. Again, I'm assuming it's probably because they have complex carbohydrates. And I think some people, I say some people, it's me included.
Hmm.
Sometimes when I eat cabbage,
Oh,
um,
yes.
yes. Sometimes when I eat cabbage, I don't know about you, Steph, but sometimes when I eat cabbage, it causes quite a bit of buildup of gas. Hmm. And not just cabbage, but to be honest, I think these are just tiny cabbage. Brussels sprouts, they're just tiny little cabbage, aren't they?
Yes.
They're just as bad. To be honest, some people, okay, I don't mind the taste of Brussels sprouts. Like, this is very debatable. I don't know about you. Do you like Brussels
I don't
sprouts?
like it.
See, it is, I think, do you know what it is? I think it's one of those foods that you either like
Love it
it or
or
or you
yeah.
don't. Yeah.
I
I
don't.
don't mind them. Like, I'm not gonna, during COVID,
Yeah.
I remember during COVID, I was working in Tesco Pharmacy at some point, and there was two women fighting for the last bag of Brussels sprouts around
Really?
Christmas. Yeah, they were like, we can't have Christmas without Brussels sprouts. I'm
Nobody's
like,
gonna
I
eat
like Brussels
it.
sprouts, but I'm not gonna fight another woman for the last bag of Brussels sprouts.
Oh, come on.
That's a few less fats in the house. I don't
Yeah.
know, during Christmas. I don't know what people are on about here. But yeah,
Yeah.
so Brussels sprouts can cause quite a lot of flatulence.
Yeah.
And I think some people say onions as well.
Oh, that's a new one for me.
Yeah, I've heard a few people. Some people even say they're allergic to it because they're like, it makes me fart.
Okay.
I'm like, oh, you're not really allergic to it. It just, it's just causing you a
A
little
reaction.
bit. But some people can't have onions because they say it makes them fart too much, so they're allergic to it. But yeah,
Oh,
some people have complained of onions.
okay.
And I think also yeast in baked products, say some
Mm,
breads that have been baked with yeast, and that would
okay.
make sense because yeast makes things sort of expand, isn't it? So
Yeah.
I suppose with gas and everything, so some
Yeah.
yeast baked products can actually cause
Yeah.
a lot more flatulence.
That makes
Um,
sense.
and I think that's the only foods I've heard about that people have
Mm,
come and said, "Oh, there's this, and it's causing a lot more of the wind." And
yeah.
but a lot of old people. I don't know if you've had similar patients. A lot of older patients, they're talking about, I don't know, about they're doing a review for their husband, and they're like, "What about his gas?
Yes.
What can we do about that? His gas is really bad."
Mm,
So that could be a lot of things. It could be maybe health related.
yeah.
Some people have celiac disease, which of course can cause excessive flatulence, or
Yeah.
even it could be lactose intolerance. So people who
Yes.
have intolerance to lactose can have flatulence as a result of having lactose products.
Mm-hmm.
So that's not the reason why I keep off. I keep off milk and cheese. I don't like the taste of it anyway, but I can't
Yeah.
really have it because I am intolerant. But that is one of the effects people have
Okay.
from eating some dairy products, I
Yeah.
suppose. You did mention something though, Stephanie. You said something about certain medications causing
Yeah.
flatulence. Can you think of any specific ones that that patients have either come to you and said, "Oh my God, since I started taking this medication, I haven't stopped farting," or that scientifically have been shown to have this as a side effect?
Okay. I'm just trying to think. Bear with me, because a lot of these medications, they cause like gastrointestinal side effects. So
Yes.
most medications will cause that. Will cause like some sort of gastrointestinal side effect, like nausea, vomiting, a bit of
Yeah.
flatulence.
Yeah. To be honest, any that causes that possibly will cause
Yeah.
flatulence as well.
Yeah. So any
Yeah.
medications that's causing those sort of side effects may come with flatulence. Do you know what I mean? In terms of like specific ones, I'm just trying to think like which patients have come to me saying they cause a bit of.
Have you had patients come to you and talk about antibiotics or any antifungal treatments causing flatulence? Because that is something a lot of patients,
but it would make sense because they cause like gastrointestinal side effects, as I mentioned. So flatulence could be one of them.
Exactly. Especially the broad spectrum antibiotics, so the likes of like doxycycline, tetracycline, those ones, because of course the way they work, they will cause that GI side effect. So flatulence might be a potential side effect as well. So it could explain why they have complained of that. I think things also, if you think about it, like NSAIDs with the way they work as well, like ibuprofen, aspirin, naproxen, they can irritate the lining of the stomach. So gas can actually be a side effect. So so
I've even thought of a few as well, even laxatives, because of the way they work as well.
Exactly.
They could cause flatulence, especially actually, come to think of it, lactulose, a lot of patients used to complain complain of flatulence, laxatives, and also metformin. I know
metformin, because it's like that's one of the side effects, GI side effects. And the reason I say this, the old people, it's always metformin.
They're like, the sugar pills is giving me Actually, I've had a patient who actually stopped taking metformin because of the flatulence. She said it was getting too much for her, so she stopped it.
Some people, because it can get quite bad.
Yes.
Especially, do you know what? If say you're quite, you're big. Well, I don't want to say big fart, but you fart quite a lot. Like you release wind and gas quite a lot, and then you take medication that makes it even. Do you know what?
It's annoying
because sometimes you can't control it. Yeah.
Imagine you're in public or like maybe like speaking to someone really of high importance or something, and then you just let loose. Like
that's it.
There's no one there
in an interview. In an interview, if it's just you and the other person, they know it's you.
And they know it's you.
You can't even be looking at each other like, who did that? They know it's you. Because sometimes if it's in public, it's like you can release it and then just be like, I hope they don't know it's me. We can all look at each other like, no one will know who it is. But you're like in a place like an interview, that's it. They won't give you the job because you'll make your workmates quit. Do you know what I mean?
It just reminded me of this advert, or like I saw it, or like on Instagram or something. There was this lady on the train. I think she had like her earphones in, and
I've seen that. She was on the train. I've seen that. That is
so bad. It looks like people on the train.
Yes,
just move her body and then like let.
And I think she kept because she was listening to music. She kept saying
she couldn't hear it.
If I just part with the music, they would know it's coming out.
Guys, don't do that. Don't do that. I know sometimes you gotta let it out, because otherwise, it gives you trap weight and starts to hurt and everything. Yeah. Like it really does. But know when to release it.
That's like, go outside. Wait, hold on until you come out of the bus and then you can release it. Sometimes, you know what? I always say in an enclosed place, you have to be mindful. There's some things, because sometimes when you're in your own home, you could just lift your bum and, it's okay.
That's okay.
But not in public.
No.
But
that's really offensive.
A patient was on something. Yeah, exactly. Oh my God! But now a patient who's on metformin, if it's excessive, you can't even hold it.
Yeah, I actually feel sorry for them. Metformin is actually one of like the Major,
A lot of people
yes, a
complain
lot of
about
people.
this.
Yes.
Yes. So if you're on
Yes.
metformin and you've noticed that you're having a lot more flatulence, a lot more releasing of gas, it is normal. It is a side effect of
Yeah.
the drug. There is things for it, but just so you're aware, it is not like, there's nothing wrong with you. It's just the side effect of the drug.
Yeah.
But again, we're not saying that everyone who's on metformin should now be, putting it down to the drug. Like, as you say, side effects are things that can happen, not things that will
Yes.
always happen.
That's right. That's right.
Yeah.
right. Yeah. So yeah, we've mentioned quite a few.
Yeah. The only other three that I know of, just because they are patients have come to me with that, and we've kind of tried to, and I always feel like this is terrible, but I always feel like I remember things that mean something. If someone comes to me with something that makes me, really think, I will remember it. So some people who take antidepressants have said that they have had a lot more flatulence, but again, GI side effects are very common with antidepressants, especially the SSRIs. So if you're on certain SSRIs and you notice that you're releasing gas a little bit more than often, more than usual, it is normal. It is one of the side effects. Another medication is statins. Statin, one of the major side effects would be something like muscle pain, but another one is also flatulence. So if you're on anti-cholesterol medication like statins and you've noticed that you are releasing gas a little bit more than normal, it is probably caused by the drugs.
Yes.
I think that is the only ones. I think we probably mentioned all the others. I can't think of any others that that possibly would. Anything that would slow down the digestion. So opioids, so oxycodone, morphine, the likes of those will normally increase gas.
Yes.
So so if you're going through this, it is you're not alone. We always say you're not alone, because to be honest, you're really not. What conditions though, Steph, can you think of that would worsen flatulence? Is there any conditions that you know that people who have these conditions are at of course, they would produce or have more gas?
Okay. So I think you've mentioned a few previously. You did mention the celiac disease, where you may get excessive flatulence, but you may get other symptoms as well, such as diarrhea, constipation, like indigestion. You did also mention the lactose intolerance. So if you are intolerant to lactose, you may find that you're getting like bloating, you're getting excessive flatulence, like a bit of stomach pain. So these are common causes of like flatulence. And the other common causes of flatulence when it comes to diseases, constipation. So you do realize that sometimes when you find it difficult to poo, basically it builds up and you feel bloated again, and then because of all that trapped feces, it tends to make you fart a lot because you're not able to excrete the feces out, so you tend to release a lot of wind. And also if you have like a condition called IBS, irritable bowel syndrome, this also comes with flatulence, as well as like feeling bloated, stomach pains, a bit of diarrhea and constipation. But these are all like diseases, or should I say, possible causes of like flatulence, excessive flatulence.
That's it.
I'm not sure of diarrhea, but sometimes, for instance, if you do eat like a bad food or something and you do have diarrhea as well, you may realize that, you are also you do also, fart a lot. Like if you have
Yeah.
eaten something bad and it's causing like diarrhea, yeah, you may also get a bit of flatulence there here and there. But these are the main diseases I would put that, especially like the gastrointestinal diseases.
Yeah.
So you could have other diseases, maybe ulcerative disease, ulcerative colitis, Crohn's disease, which could also cause like a bit of flatulence. But the
Yeah.
main ones, the possible causes, are the constipation, IBS, celiac disease, and lactose intolerance. Yeah.
That's it. And I think they
Yeah.
say also like some cancer, because of course some cancer, especially if it's like cancer of the intestines, because
Interesting.
it
Yeah.
can cause blockage of the intestines. So it can actually
Yeah.
cause a lot more flatulence. So
Mm.
be a bit, gracious to people who are having a bit more flatulence than normal, because you
Yeah.
don't know what's going on. You don't know what
It's
medications they're
true.
on, what the conditions,
Yeah.
what the, what medical conditions they have, and things like that. Sometimes
Yeah.
they can't even help it.
Yeah. It's
You've had 2 boys.
mm-hmm.
So how was it during pregnancy? Like, did you find that you are more prone to producing gas?
Well, you know what? During pregnancy, it's a wonderful journey. You have the
I bet it
days.
is the way you started.
It's a wonderful journey, truly. Yeah. Listen, when it comes to your bowels, yeah, you have your
have no
days.
control.
You have your days, let's put it that way, where you have your good days and your bad days. And some days, it is good where you're releasing the wind as normal. You're
Right.
going to, you're using the bathroom as normal. But there are other
Right.
days as well where it could go the other way. And it also depends on like the medication you're on. For instance, let's say for instance you're on iron tablets as well.
Yeah.
Because let's say for instance during pregnancy your iron is a bit low. That also affects your bowel, and sometimes
True.
may, cause you to have excessive flatulence. For me, during pregnancy, it doesn't really affect my bowel as much. I normally have like a normal bowel, movement, and my flatulence is normally normal. But I do realize that because my iron is low, as soon as they put me on iron tablet, that's when my stomach changes, basically. Let's put it that way. And yeah, that's when it does affect me. So with pregnancy, it is different. During my pregnancies, yes, they each gave me different symptoms. The first pregnancy, I think, was fine. The second, not too much,
Okay.
Because, yeah. Not too, yeah. It does affect my bowels where, yeah, sometimes you do have the excessive flatulence, but that's pregnancy. Pregnancy, there is like changes going on in your stomach, like the abdominal area.
Your body's not your own.
So exactly. So there are some women who may have excessive flatulence during pregnancy, which is normal. It is normal.
Yeah.
But after pregnancy, you do go back to normal. So
Thank God
fine.
for that.
Yes. Yeah. But I just remember the iron tablets as well. Like it causes flatulence, because sometimes you could have it the other way, whether you're getting diarrhea as a side effect or constipation as a side effect, and these also causes you to have sometimes bloating and sometimes trapped wind, and you get excessive flatulence. Yeah. Fantastic.
Good to know.
Yes.
I mean, the reason I ask this is because a lot of like patients who've come in, they like pregnant patients, they come in and they're either going through, they're having really bad acid reflux, or they say that they're having really bad flatulence, like they just can't control, like either so acid reflux and then burping, and of course flatulence. Now my sister, when she's been pregnant, it's always been the burping. Now maybe she has flatulence, but maybe she just goes to the toilet. I don't know, but I'm just going by what I have observed, like for how the air comes out from one side. That's what I've noticed. But some people, it could be that. Some people, it could be flatulence, or even like just build up of gas, which is like acid reflux as well.
That's right. That's right.
Oh,
okay.
We suffer, women. We go through it, don't
we? We really do.
We go really through it.
Yeah.
Honestly.
It's all good. So let's say, for instance, there's someone where, you know, this excessive flatulence is really great in them. They really need something to help them, you know, manage this symptom. What would you advise them on? It could be some lifestyle changes. It could be some medication.
Okay. So whenever patients come in, see, I don't know about you, Steph, but I've observed that the patients who come in to get something to relieve flatulence are normally the older patients. A lot of the younger patients probably are very embarrassed about it, so they don't come to pharmacy for it. But a lot of older patients come in, and we always just go through sort of like their habit, like their everyday habit, eating habit mainly. So how, like, what do they eat to start with, and how do they eat as well? So normally, of course, we've talked about the foods that could possibly cause flatulence. So it's normally maybe try reduce the intake of some of these foods, because of course that's going to build up more gas, and you'll be releasing air even more often. So that is normally, you know, one of the main things really. But also they say, and it has been proven by science, that eating smaller meals can actually improve or can actually reduce the amount of air buildup, the amount of gas, buildup. So so symptoms of flatulence normally improve if someone eats 4 to 6 smaller meals every day, as opposed to 3 very large meals. So that is normally something that I would normally tell them, just eat smaller meals, because then there's not too much gas that's being produced to sort of like fight everything or work with everything. And also just eating slowly. That is easier said than done, because if you're in a rush, you've got only, I don't know, most people, you know, get like, I don't know, an hour or half an hour lunch, and you have so much to do during that hour. You want to run your errands, you still want to eat some lunch, so you want to eat as quickly as possible so you can do all the errands. But sometimes actually eating quickly is actually the reason why you're going back to work and your colleagues are a bit, you know, you're scaring them away because you're fighting a bit too much. Or maybe you're just seeing people's faces just like turn, because like, you know, there's something going on in that room. So they say eating slowly actually helps with reducing flatulence, because to be honest, people don't realize, but the digestion actually starts in the mouth. So chewing foods slower goes slower through the system all the way down. Also just avoiding normally some carbonated drinks, but also gum. I used to be so big on chewing gum, like when I was younger. But I don't remember farting that often. So I don't know. It probably didn't affect me that much.
Are you sure, Trudy, that you don't remember?
I don't remember farting that often, honestly. Like, I used to chew so much gum, like when I was younger. But
that's not good. Yeah.
Good. But I feel like, do you know what? Sometimes with farting as well is age. I think your system's a bit slower, isn't it? So I suppose when you're younger, it's like the air just goes in and out, you know. And it's because, as we said, people fart up to 14 times a day. So sometimes you actually fart and you don't realize. You just feel like your butt cheeks sort of open a little bit and there's some air comes out. You don't realize that's a fart, but it's actually a fart. You know, so some air comes out without you realizing, but they say avoiding, of course, gum and carbonated drinks can help with that. But I was good with gum. Like, it never affected me as much.
Okay.
I think also reducing smoking. So reducing smoking has shown to also reduce the amount of gas that is being released. So reducing the amount of times you will fart or flatulence, basically. And also just the foods that we've talked about, you know, dairy, beans. Those normally would reduce the amount of gas buildup. And also
Yeah.
they say I don't know if you've heard this though, but charcoal, there's some pads that are
Yeah.
made from they've got like some charcoal, infused. And basically, because we know like what charcoal does, it absorbs a lot of things, right?
Yeah.
So they have these pads, especially for like people who fart really bad and maybe it smells really, really bad.
Yeah.
So they have these charcoal pads where you put it on, and so basically when you fart, it's kind of absorbed in the charcoal.
I mean, that sounds...
I've not seen them. I've not tried them.
It sounds wonderful. So does that absorb the smell?
I think it absorbs the smell. I'm not quite sure about the sound. Sure it absorbs that. I know for sure it absorbs the smell.
Okay.
But I think the sound will still come out. It will still be, it will still, people will know what's happened. Just won't smell it.
Smell it.
Well, they just won't smell it. No, this is something
like,
I have
pretend
read.
as if maybe you moved like a chair or something,
Yes. Yes. So I suppose maybe this is for times that maybe you feel like maybe your flatulence is getting in the way of everyone's life, like every time you do people discuss, then maybe some of these pads might be useful.
Yeah.
But so those are just sort of like some home remedies that you can use. But there is treatment in pharmacy. So we do have the two very common ones that we sell, and you'll find them readily in most pharmacies. It's something called wind ease, and as the name suggests, it just eases that wind. So the active ingredient is simethicone, and it just basically reduces the amount of I suppose I think it works with the gas in the stomach.
Yes.
And it just reduces the amount of times you will release gas because of, less buildup of that gas in the stomach.
Yeah.
Another one is wind settlers. Wind settlers is something that you can also get in pharmacy. And again, just like wind is, it will help relieve with excessive flatulence. So those are the two very common and readily available ones that you can get in most pharmacies. Unless, Steph, you can think of any others that's come up or I don't know about that I'm telling my patients about.
No, I think for me, the only thing is like for kids, for instance, like babies, what I realize is that sometimes, they get like the trap winds, which, sometimes you need to release it, the native, like the simethicone works, which actually you mentioned, but they have the Infocol. Some adults have the Infocol to help them with, what's it called, with excessive flatulence. So if, you want like a liquid or something, I guess Infocol is an option as well. Yeah.
I suppose, yeah.
Yeah. The other thing is just my home remedies, what I normally do. Let's say, for instance, because what I normally do. No, it's just really simple. What I normally do is that when I know I've eaten something bad and I know I'm probably gonna get like excessive flatulence, I drink warm water. Yeah, like sometimes you get trap wind. It really does. Or like trap winds. What it does is that I find out that the warm water basically traps like the wind and it makes it comes out like and it eases you. And then
does
eventually
it come out with
it
a sound
stops.
or
I don't know, truth it does. Why are you trying to expose me?
I just want to know, because when you're trying these home remedies, we need to know when to try them. Is it around people? No. Is it on your own? So
Well, I do it on my own, but what I realize is that it really settles me. Like it really settles me. Like the flatulence tend to literally cease. So it's either that, or I have like something like peppermint tea, or a bit of like ginger, or maybe like ginger tea or something. Those tend to help me. So I don't know about you. But those three
good
things.
Thing you've mentioned peppermint tea, because there's peppermint oil capsules as well that you can get over the counter in a pharmacy. So those can actually be used for flatulence, because they actually do work for a lot of things. If you're bloated, because if you're bloated, most of the time it is gas. So for
Yeah.
bloatedness or flatulence or trapped gas or even like diarrhea, constipation. So
Yeah.
peppermint oil capsules are available in the pharmacy, but peppermint tea is just as good. So yeah, I'm glad you mentioned that actually.
Thank you.
That is interesting. That's very, very interesting.
Yeah.
Is there
Think
any, like, just thinking about flatulence, is there any time you think that maybe someone needs to seek medical advice or they need
yeah.
to get that checked?
So I think in the beginning I mentioned some few things. So when flatulence get a bit excessive, it's not your normal occurrence. It's a bit more than usual. I think that's
Yeah.
when you want to seek some help. But I also mentioned, if let's say for instance the flatulence is accompanying other symptoms, for instance maybe some abdominal pain, maybe you've had stomachache for ages and you've got some excessive flatulence as well, which is not going away, or it keeps going and coming back. These may be a sign that you probably have like some underlying a disease there that needs to be, looked out for. Again, maybe if flatulence comes with like other symptoms such as like constipation and diarrhea, it could mean that, there's some sort of underlying disease as well that could be causing these symptoms. So it needs to be checked out.
True.
Trudy also mentioned like there are some diseases or conditions that causes flatulence, such as cancer. Let's say some bowel cancers, like, can cause symptoms such as flatulence and some other symptoms. So let's say, for instance, you realize that, okay, you've lost a lot of weight. These are signs of like the cancer, and also maybe if you're getting some other gastrointestinal effects as well with the loss of weight, you're getting excessive flatulence, maybe diarrhea, constipation, or even like your bowel movement has just changed in general.
Yeah.
Yes. Or for instance, you're seeing blood in your stool. These could be signs of like the cancer. So anything out of the ordinary, please seek for help. Or just in general, if like farting is affecting your life, or you just need help, like, to help treat it, and like the pharmacy products are not helping, do speak to your GP. Maybe there could be something going on. That's why like the normal remedies or the OTC medications are not working for you.
Not working.
And so those are the times that I would say you should seek for immediate help. You should seek for help from like your GP. But other than that, farting, flatulence, or releasing of wind or gas is normal. It's a normal thing, and as Trudy mentioned, 8 to 14 farts a day is normal. But anything beyond that, yourself that, okay, I need to seek help for that. Yeah, exactly. And that's when I would. Yeah. Okay.
That's good to know. That's really good to know. And what I would also add is if the smell, I don't know if you said that, if the smell is worse than usual. If the smell is worse than usual, if you I mean, we know, we kind of have an idea of what our farts smell like. So if you notice that the smell is a little bit extreme, that might be a reason for you to get something, to get yourself checked.
Yeah, definitely. So we've gone through quite a lot, like, the mechanism behind farting, the causes of it, how you can manage it. So what would be your take-home message for people out there?
Okay. Before my take-home message, I have a question for you, Steph.
Okay. I just know this is going to be a bizarre question. Yeah?
It's not. It's not. Let's this is consultation room podcast. Okay, we're in the room. Okay, so whatever is said in here stays in here. Okay.
Okay.
I can't say the same for for fat. It doesn't stay there. Always spreads. would you fart? Who would you fart in front? Like, who would you fart around?
I knew
like,
this question. I knew it. You know, I wasn't going to ask you yet. Honest. I just knew you were going to ask.
Let's be honest here. Only because it's going to be a very easy and we leave it as that.
Listen, I've been seeing the debate online, and I was just in my head, I was like, I hope Trudy does not ask me this question yet. And I was trying to avoid it. I was trying to avoid that question, I was like, oh. But since you asked,
we are the Consultation Room podcast. We can't help it.
Since you asked, Trudy, listen, I'm gonna be honest here, So I saw this debate going on, like saying, "Oh, would you fart like in front of like your partner or like your husband or something like that?" And let me be honest. Initially, I was hiding my farts in front of my husband, because,
I didn't know. Were you wearing the charcoal?
No, I would maybe excuse myself and go to the lady room and then go fart.
You would last until you walk out?
My stomach used to hurt a lot, Trudy.
Must have.
This was the dating... the dating times,
Yes.
When I first met him.
Trying to maintain a nice image,
Thank you. Thank you. So, I was really embarrassed and I didn't want to do it, next to him. But, Trudy, after how many years? Over 10 years. Probably,
when you got the ring.
I don't know, 11, 12 years.
Give him the babies.
Before we got the ring.
No way.
As time goes on, I'm not gonna lie to you. There are times I don't have the time to go to the bathroom. So when it comes, it comes. I'm sorry. I'm sorry. We all let it lose, and now, we're kind of used to it now. We're kind of used to it.
That's it.
It doesn't bother any of us.
Do you know what? And it's your husband, so...
But would you, Trudy? Knowing you, I don't think so. I know the way Trudy is, I don't think you would. Trudy will hold it in. I know you.
I'll be very, very honest, So, any of say my previous boyfriend, they don't even know I fart. I am like an angel. Listen, there's no air that happens in my belly. That is a myth. Farting is non-existent. Okay? Pooping is even non-existent. Smelly poop? No. No smelly poops. No. But my boyfriend, I think because we've got so comfortable and he's basically he's my best friend, right?
Aww.
So I think I've got quite comfortable because... Do you know what? I think it
I'm
the
so
first
shocked.
time. I know.
I'm shocked.
The first time, I'll tell you the story. I'll be very honest with this story. So the very first time it happened, I think we were just. I think we were literally just chilling. I think watching a movie or something, and then he made me laugh, and then it came out, 3 times. And I was shocked myself. I couldn't believe it. I was like, when that happens, you're thinking, what do you do? And then he was like, what just happened? And I think, do you know what? I think the fact that he didn't dismiss it, but he done it in a way that was funny and he kind of just made fun of it.
Yeah.
I kind of got comfortable with it. I was like, and he would remember that time you shoot 3 in a row. And I was like, oh no. And then I think with time, we've been together 3 years now. So I think with time, it's got quite, we've got quite comfortable that if I tell you what, just the way I think the way I am, I wouldn't lift my bum to release it as such, right?
Yeah.
But sometimes when you don't do that, the way your stomach will hurt. The way your stomach will hurt.
Listen, I've suffered during the dating times,
Honestly, like, no,
Yeah.
like, I don't know how you did it, Steph, because the way, and sometimes,
That
you know
was
what,
back then, not
when
anymore.
there's excess gas, even your stomach, you can see the
Yeah.
bloatedness as well.
Yeah. It's so true.
So, yeah, so it's one of those, like, I try the quiet ones, like,
Yeah.
but sometimes that's the thing with farts. They come
Unexpected.
unexpected. So sometimes you think, you know what, sometimes you think it's gonna be nice and silent, and no, it's not. It's a rocket. It's a rocket coming out. So, like, I think also growing up, it's like, okay, this is normal, okay? Like, I am a
Yeah.
pharmacist, okay? I should make this a
Yeah.
normal thing. Like, I shouldn't be like, I'm running and you can hear me running and releasing a little bit. So it's like, I've got to a point where, okay,
Yeah.
if it happens, listen, I'm human. But
I
do
can't
you
do
know
it
what?
in front of like friends and stuff. With my husband, I
Oh gosh,
can.
no.
Yeah.
Oh
Like with my
gosh,
kids, I'm
no.
like, come on, man. My
Yeah.
husband and
Oh,
kids.
yeah.
But
Exactly. Do you know, even my family, I
anyone
couldn't.
apart from them. Yeah, I can't. My dad, no. My brothers, no.
No.
I can't.
My sis. Do you know what? Like, I like, even with my sister, we'd be watching a movie, and I think she
Yeah.
would, like, she probably has heard me fart maybe twice. It would come, you know, when it comes in a way, boom, you're like, oh,
Yeah.
it comes before you catch it, like, before
Yeah.
you know, and like, because I would still try my best to, like, do something about it. So
Yeah.
anyone else, I don't even think my dad thinks I fart. I think he thinks I just,
You don't?
I'm just a unicorn. I
You know?
don't fart.
Only
Yeah,
rainbow is coming out.
exactly. So my family,
Yeah.
no.
Yeah, I can't.
My partner is probably the only person and my young
My
sister,
husband and my
unfortunately.
kids, those are the only ones. No one apart from them. I can't.
And
I was too embarrassed.
I think that is acceptable, I think that is acceptable. Yeah, that is acceptable. And do you know what? I feel with my boyfriend, like, he's, as I said, he's my best friend, he's literally my partner, right? Like, I'm so comfortable with him, hence why I'm not necessarily as embarrassed as I would be.
Yeah.
Because I think when you find that person where, like, that's your person, it's like, they're not going to judge you. They're not going to be like,
exactly.
you know, you're comfortable. So, yeah,
So true.
I have shot a few fast and loud ones around him, and I'm not very proud, but it has happened, and it is normal.
Yeah, and that's what I want. Like, that's why I don't do it all the time in front of the kids, but I want them to feel that, no, this is a normal process, you know? You don't need to hold in your fart, because I don't want my kids to come and say, Mommy, my tummy hurt because, I was holding in my fart. No. So I tell them, you can do it. Like, just do it. If it stinks, I'm not going to embarrass you. Don't worry, I won't embarrass you. But it is a normal process. I tell them it's a normal thing that happens to us, because at the end of the day, if you don't release it, you're going to get really, like, painful stomach aches. Yeah. So they do it. Yeah.
100%. See, when I was young, I'll just tell you a very quick story. When I was young, my mom, I think part of the reason maybe I couldn't do it in front of my parents, my mom made, like, a weird thing. So, like, I remember, like, I was maybe like 6 or 7, right? And, like, maybe she'd release a quick one. I'm like, Mom, did you do that? She said, no, it's just the train. Or it's just this. It's just this sound. I'm like, Mother, no, that was you. But, like, then it became like, oh, wait, is this like a taboo thing? Like, are you not supposed to be doing this, So going forward, I kind of, like, watched what I did with that, with the gas. Yeah. But it is normal. It's a normal thing, guys.
Exactly.
Yeah.
Okay.
So what would your take-home message be, Steph, in regards to this topic?
Okay. So when it comes to flatulence is a normal thing that happens to everyone. It is caused by, wind being trapped in your stomach and you releasing it as, fart. When it comes to flatulence, it is caused by different things. It could be caused by food, by drinks, by medications. So if you are someone that maybe you're farting excessively, do watch what is causing that. If it is food, minimize what is causing that. If it is maybe a drink or maybe a type of medication, if it is a medication, speak to your healthcare professional so that they might give you options of, changing or trying something else. So always look at what is causing you to have like that excessive flatulence. If excessive flatulence becomes like a problem and it is accompanied by other symptoms which cannot be explained or is not going away, do seek help from your GP so that they can have a look at it. Do try some home remedies if you do have normal flatulence, and just to help you ease that flatulence, you could try some home remedies, which works best. And if that is not working, always seek help from your local chemist, where they will give you some over-the-counter medications such as the wind settlers and the wind ease. But all in all, my take-home message is that do not be embarrassed when it comes to flatulence. It is something that is normal, that happens to everyone. If you're not releasing any flatulence, then I'm sorry, you're not normal. So it is a normal thing. And my take-home message: embrace it, release it. Do not give yourself that that stomach ache. But when it becomes a problem, do seek for that help. Yes. So what would be your take-home message?
So my take-home message on about flatulence is that, as we have said, just literally throwing through, it is a normal thing. So this topic might induce laughter or even embarrassment, but let's just be honest, flatulence is something that everyone will experience. And if you say no, when you were a baby, you were, producing and releasing gas.
Yeah.
So you have done it one time or another. And understanding flatulence is very, very important in maintaining digestive health, as well as overall well-being. So just understanding what your routine is in regards to flatulence. Of course, as we've said before, if you notice any changes, maybe get that checked. And of course, just discussing any causes, effects, and management openly is very, very important, because it is like any other condition. Well, it's not really a condition. It's just an experience, it's a human experience. It is a normal thing. So it can be a condition if it's becoming, of course, if it's getting in the way of life. So embrace the humor, learn something new from this episode, and remember that flatulence, as we've said, over and over again, is a natural and normal part of the human experience.
Yes.
Everyone does this.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.